Hi everyone, welcome to my channel K7 Therapies. I hope you all are doing great and my videos are proving to be beneficial for you all. So before people join in for this live session, if you are new here, do subscribe to my channel K7 Therapies to get updated about all the tips and tricks that we use for occupational therapy for the kids at home, where you can actually perform a lot of activities to engage your child at home very easily. Also, these things prove to be really beneficial for your children as well. So let's get started with the topic. So today's topic of discussion is how to improve eye contact in your child. So when we talk about how to improve the eye contact in the child, let's discuss about the problems. Basically, what exactly the problems are faced by the parents. So अगर हम बात करते हैं आई कांटेक्ट के पुअर होने की, तो यूजुअली ये सब देखा जाता है बहुत यंग एज में, विच कैन बी एज यंग एज 6-7 months और विच कैन बी एज लेट एज 7 years 8 years old, जहाँ पर पेरेंट्स आर समटाइम्स दे बिकम हेल्पलेस जब उनको कोई एक्चुअल में कोई स्कोप नहीं दिखता है कि आई कॉन्टैक्ट हम कैसे बिल्डअप कर सकते हैं, क्योंकि बच्चा कई बार ऐसा होता है कि बात ही नहीं कर रहा है. मे बी नंबर 1 रीज़न सोशल इंटरेक्शन बहुत पुअर होता है. द चाइल्ड वांट्स टू रिमेन आइसोलेटेड, वो बहुत ज़्यादा बात करना पसंद नहीं करता है. सो अकेले रहना ज़्यादा पसंद करता है. तो दैट इज़ वन रीज़न जिसकी वजह से आई कॉन्टैक्ट उसका बिल्डअप नहीं हो पाया है. या फिर बच्चा सोशल स्माइल नहीं देता है, बिल्कुल उसका इनिशियल लेवल पर ही सोशल इंटरेक्शन बिल्डअप ही नहीं हुआ था. तो दैट कैन बी वन रीज़न. अगर हम इसको भी ऑटिज़म से रिलेट करते हैं तो यूजुअली ऑटिस्टिक फीचर का सबसे कॉमन द कॉमन फीचर इज़ कि बच्चा जो है वो अपने आसपास की सराउंडिंग्स में किसी से भी बात नहीं करना पसंद करता है, चाहे वो पेरेंट्स हो, फादर्स, मदर्स, सिबलिंग्स, रिलेटिव्स, नेबर्स, कोई भी हो सकता है, XYZ पर्सन. हाँ, देयर कैन बी अ फ्यू पीपल जिससे बच्चा बहुत ज़्यादा क्लोज है, देन डेफिनेटली वो आई कॉन्टैक्ट बना के रखेगा. बट यूजुअली when there is poor social interaction, child refrains from getting in touch with the people around. So जिसकी वजह से आई कॉन्टैक्ट में इशू आता है. So आज हम बात करेंगे कि आई कॉन्टैक्ट को हम कैसे और ज़्यादा ओके फाइन. सो यू वांट इंग्लिश? ओके फाइन. So today we'll discuss about the topic how can we actually improve eye contact at home simply. See, if you have any query about anything जो where you feel that you are not able to help your child at home, do consult a professional, do go for occupational therapy evaluation, because they can actually assess and evaluate the child in the best possible manner, where you can actually get help regarding eye contact, speech, sensory issues, attention, hyperactivity, a lot of concerns that usually parents have. So it is very important that you actually observe the child very keenly. That is very important, because when the child is younger, at this particular age, before 5 years of age, the more you will observe your child, the more you will get to know. And also when the child is young enough, it is the best age of getting all the development, where the child can actually learn what all the things which the parents are wanting to teach the child. So below 5 years of age is the perfect age where you can control all the behavioral issues, where you can actually focus on attention, academic, speech, everything. So it is a suggestion, you can say, it is an advice, you can say, but try to consult an occupational therapist if you feel there is something wrong going on with the behavior, eye contact, speech, attention, anything. So try to consult an occupational therapist for better guidance for the future. As as early it is intervened by a professional, the better you will get the results for future, because at the end you need to put the child in the school, he will go to a school, then you have a lot of academic activities, you have extracurricular activities, so that is very important. So when we talk about the eye contact, basically what happens is, when you are calling your child, the child may not be listening to you, number 1. Number 2, the child is listening to you, but he or she is not responding. So there can be two things. Now, number 1, it can be either behavioral, It can be either sensory. So when you are calling the child has listened to your call but is ignoring you. That is behavioral. Number two, the child hasn't listened to you because he is in some other zone and is not actually paying attention, or is sensory issue. Due to sensory issue, the child is unable to focus to your call, to your words. So that can be sensory. So you have to be very observant. Again, you need to be a spy, you can say, for the child, where you can actually find out whether the child is being sensory, whether the child is having sensory issues or it is behavioral issues. So you need to be very careful about it. Number one, this thing. Number two, you need to obviously get your child examined for like general hearing impairment, because usually it is not there, but still for the safer side, to be on the safer side, you should get your child evaluated for the beta test, you can say, the hearing test, where you can actually get to know that the ear, like the organ, is working fine, and there is only sensory related issue. And when you find out that there is only sensory related issue now, then you can definitely start consulting the therapist, like occupational therapist you can go to, speech therapist you can go to, who can help you out with the therapeutic measures, because these things can only be controlled. They can only be handled with care, with patience, and with manual therapeutic measures. There are no medications, there are no injections, no surgeries for these kind of concerns. So you need to be very active with all these things. Trust your occupational therapist. Have that level of patience where you can actually bring out the best of results with the kids. There are a lot of parents who lose their patience in between. They might feel that there is no result coming in 10 days, 12 days. It does not work like that. It is nothing, it is no sort of a magic. It is actually kind of a training for the brain which we are doing. So when you are training the brain will take some time to respond to what you are actually teaching the child. So it is very important for the parents to maintain that level of patience and calm with the child. And the most important thing is trust your therapist. Whether you are taking online therapies, offline therapies, every therapist is putting in a lot of efforts to bring out the best result for your child. But you have to actually cooperate by maintaining that level of calmness and patience with the child. So okay, moving on to the important topic of discussion for today, which is how we can actually improve eye contact in child when the child is not looking at you. When you're talking to the child is looking here and there, like right side, left side, up, down, getting distracted. So how can you actually maintain that level of eye contact? So the first and very easy thing which we can use is the bubbles. So you can actually blow some bubbles out, which the child will try to pop. Definitely he is gonna look at it. So with this practice every day, you can gradually bring out better eye contact in your child. This might look very easy and very simple, but this actually works for your child, and also it is very enjoyable. So the child will enjoy it also, and it is a fun activity. Later on you can use these bubbles only for oromotor activities as well. So that is a separate topic that we'll discuss in some other live session. But today for eye contact, you need to blow out the bubbles yourself. You need to spread the bubbles in different directions. Let the child run behind the bubbles. Let the child focus on different bubbles and ask them to pop it out. So this is one activity which can be done very easily. Other activity which can be done are these flashcards. Like I have two flashcards here. There are a lot of flashcards available. I have a bundle, so like I have picked up two only right now. So one is my first word flashcards, then other is fruits flashcards. So if we talk about these flashcards, so what you have to do is, for example, you have this fruit, pomegranate, or you have mango, for example, or you have any other fruit. What you have to do is actually make your child sit in front of you. Okay, so for example, you are the child and I am talking to you. So you need to sit closer to the child, where child can actually there are less distractions, and he can actually focus on what you are saying. So you need to say mango. You need to take it in front of the child's eyes and then bring it back. So you need to maintain that eye level or the nose level with your child. So you have to say mango. So you have to take it to the child and you have to bring it back to your nose. So this is mango. So you need to do it like that. So this way you can work on different flashcards. There are vehicles, there are fruits, vegetables, and action words. There are a lot of things available in the market. Other than that, for example, colors also, or like I have blocks and puzzles also, you can do the same thing. For example, I have these blocks here. So if you say orange, so again you need to you have to bring it closer to the child's nose and say orange, and you need to bring it back. So you have to maintain this level of eye contact with the child. You can trust me on this, the child will definitely look upon when you will do when you will practice these kind of games. So this thing can be done with any other toy, any other game. You can do it with the flashcards, with the blocks. We can you can go with the this thing puzzles. You can go with small toys, Legos, Squigs, anything. Simply take the block, move it in front of the eye of the child and say orange. So like that you need to maintain that level of eye contact. Okay, now the next thing is very easy again. You must be having these stacking cups here. Like I have this thing. So this is from Fisher Price. These are the stacking cups which we can use. So how you can use, so there are a lot of colorful cups here. So you can go with like this. You have to just turn on your phone's flashlight like that, and you have to put it here. Like it's actually very bright in the room, so you might not be able to make out the difference, but yeah. So you need to turn off the lights of the room. It should be completely dark. So you take the block like that, the cup, put it on the flashlight, and you have to again show it in front of the child's eye. You have to move it slowly up and slowly down like that, then right and left. So you need to change the direction slowly, and you can actually track that the child is moving the eyeballs according like wherever you are moving the cup, the child will track it in the same direction. Then you can simply move it in circular direction. So like that you can go. So this actually helps with the eye contact again, because the child is focusing on the light which you are showing. Other than this, there is something called as visual stimulation, visual seeking behavior. Any autistic child may look at the lights, moving wheels of the vehicles, anything like that. So for that reason you can also use this activity, and for maintaining that eye contact also you can do this activity as well. Okay, other than that, whenever you are sitting with your child, try to look in the eye of the child. Like for example, the child is sitting to you and he's busy playing with some game, and you are busy on your phone or you're doing something else. Stop your other work, try to sit and play with the child. It is very important to engage the child as much as possible. You have to sit with the child and engage them in actual conversation. You have to maintain that eye contact. Like you will initiate it, then only the child will copy you, because the child will learn from what parents, siblings, or anyone of the family member who is doing. So the child is very understanding is in all of these aspects. So you need to focus on that actual conversation, maintaining an eye contact with the child. That is very important. So try that, try for that. Next thing is try to record short videos of your child, where the child will face the camera and he will or she will talk about any topic. If the child is verbal enough to talk about some topic, family, house, anything like that. So try to make them speak all these things in front of the mirror, number one. Number two, try to make them speak in front of the camera. This can be done. Other than that, for example, whenever someone comes from outside, ask the child to greet them. Hello, hi, good evening, good morning. So this is also one thing. Then the last thing is see off, like saying bye, see you, good night, like that. So that is also very important, where you ask the child to actually talk in front of the people. It can be strangers, like whenever you are actually in your supervision, it should be there. So whenever you are there along with the child, try to make them contact with the people. You have to actually look into their eye to maintain their eye contact. So this is one thing. Other than that, whenever you are doing any activity with your children, do it in the closest proximity or in the closest space available. It can be a chair table, it can be on the floor, but it should be very less people, very less disturbance, and very less distractions in the room. So these are the few activities which can very easily be done at home. I hope you like this live session. So if any one of you has any query, do let me know in the comment section below. We'll be happy to help you out, and do actually follow these kind of tips and tricks to actually help your child out at home. And number 3 is, whenever you feel like having any like if you feel there is something, any kind of sign or symptoms or features which you are able to observe in the child, try to focus and try to consult a professional. Don't try anything random from YouTube or Google, but yes, always do the things in any professional supervision. So I hope this session was beneficial for you all, and do subscribe to the channel if you are new here, and we'll meet in the next video and YouTube live session maybe. So thank you so much for watching the video, and do like, share. Yeah, so there's a query, I think. Okay, occupational therapy scope you want to know. See, occupational therapy is something where you are helping a lot of yeah. So occupational therapy is basically a medical field where you are helping people of any age group. It can be older patients, it can be pediatrics, it can be adult, it can be orthopedics, neurology. So there are different categories in that. So where you are actually helping out people to become independent, to come back to a normal life after suffering any kind of condition or any kind of physical accident or like that. So that is what occupational therapy is. So like me being a pediatric occupational therapist, we are actually focusing on children with autism, you can say, where we are working on the sensory integration part, where we are working on the oral motor skills, the speech part, oromotor therapy you can say, or oral placement therapy you can say. So this is one thing where we are actually helping the children to get independent, focusing more on the like whatever the requirement is. When we talk about autism, so there are a lot of sensory requirements in the child, so that is one thing. If you talk about the orthopedics part, so there are a lot of conditions where we have our role. It can be backache, it can be cervical pain, knee pain, all of the conditions like this. Then hand therapy is another thing which we focus on, like fine motor skills, hand functioning. That is one thing where we have scope. And if we talk about the areas, you can definitely have a job in hospitals, government setups, private setups. You can work in schools as a pediatric OT. Then you can work in different NGOs. You can work in you can open up your own private setup. So these are a few areas where you can work. Then there is something called as ergonomics. So ergonomics is like creating a lifestyle, creating a home with the safest environment where you can actually help out people after any condition. For example, if a person is paralytic, if he has suffered stroke and is unable to walk or to work from a desk, so you need to modify the desk, or you need to modify the home in such a way that it is easier for that patient. So ergonomics works like that, considering the posture, the body level, the body coordination, where you are actually not hurting any of the joints, any of the muscles, but actually making the work easier. So this is something about occupational therapy. I hope I'm clear, but there are a lot of videos about OT and their scope. You can watch out that also on my channel. I will put the link in the description. description box. If you still have any query, you can mention it here in the comments below, because this session was specifically for the like pediatric, where we can help out the children for better eye contact. But yes, so this was something very brief about OT. But if you want to know it in detail, I will mention a link for the video which has actual everything in the detail about occupational therapy. So I hope you got some idea about OT, and all the best. So thank you so much. Okay, how to develop eye contact for children with visual seeking. So when the child is visual seeking, you need to actually first of all fulfill the child's sensory demand. This is something called as sensory diet. If the child is seeking some kind of sense, you need to fulfill that sensory diet with giving them the visual stimulation, visual therapy, where again you can work with the flashlight activity, this thing which I showed with the stacking cups. This thing you can go for. Then you can go for light projectors are there that you can use. Other than that, bubbles again. Then there is something like colorful balls you can use in any of the activities that can be done. So visual seeking behavior has to be controlled first, then you can gradually work upon the eye contact activities. But still like I don't think I'll be able to help you out here, because unless and until we see the child, we'll actually, there is a very less information. So we need to assess and evaluate the child first. We have to know what actually the child is seeking and how is he behaving. These things can definitely come in control. It's just about the sensory integration and sensory diet which you need to give to the child. So control the visual seeking and this thing hyposensitive behavior first, then we can work upon the eye contact part. And eye contact is somewhere or the other related to the speech aspect as well. So we need to club it up, and then we need to perform the activities. Okay. See, Bachelor's of Occupational Therapy is a very good course, no doubt. It totally depends after your bachelor's where you go for the job. You go for hospital, then there is a different scale. If you go for colleges like as a lecturer, maybe after your master's, then there's a different pay scale. So everything is very like variable here in the field. So it totally depends on your choice of area where you start your practice in. It totally depends on that. It is a very good this course has a very good scope, no doubt. Out of India also they have a very good scope. They have a lot of job opportunities as well, so you can definitely try for abroad as well. Also, if you have any query related to your child, like what all concerns you are facing, you can let me know in the comment section, or I will mention the email ID and Instagram page. You can DM me there as well, because it is, I think, without knowing the child, it becomes a little difficult for for any therapist or any professional to give you that detailed help, basically, because these videos are very generalized, keeping in mind every child, be it mainstream, autistic, or anyone. So it's like that. So if you want to talk about your child specifically or little concerns there, then there's a separate thing which we can do, which we can discuss about. So do let me know if I can help you out in any manner. And I hope the session was informative for you all. Thank you so much for watching, and do share the video if you like it, and we'll meet in the next live session. Thank you so much for watching.